So I'm just going to ask you guys some questions. Feel free to answer it, whoever wants to.
Sure.
So the first question I have for you guys is, what is intensive outpatient?
So in terms of the continuum of care with substance abuse treatment, mental health, co-occurring treatment, there's a way that it's been set up for a long time where it goes from detox to residential to PHP to IOP to outpatient. Our level of care is PHP, which means partial hospitalization, which is kind of a dated term. It essentially means day treatment, which means they're here Monday through Friday, 9 to 3. Intensive outpatient, what it inherently means is people are programming at the licensed clinical building anywhere from 1 to 5 days a week while getting reacclimated back into the stream of life, learning how to navigate newly sober. Often most of our guys are coming out of a 30-day inpatient program. Some of them are just completing a medical detox, but they're doing individual. We have therapists, we have counselors, we have psychiatrists, nurse practitioners. We have really everything that they need for them to really kind of have the full continuum. So they're here doing outpatient anywhere from 1 to 5 days a week. It includes groups, it includes case management, it includes individual therapy, individual counseling, doctor's visits, things like that. And we really try to individualize it for each guy, and each guy's really programming with other guys that are at the same level of their process, whether it's the phase 1 of our program, phase 2 of our program, phase 3 of our program, guys engaged in just outpatient who have been here for a year. It really varies.
How many clients can you guys hold at a time, typically here? What does that look like?
Yeah, so we have bed space for 30.
Awesome.
But we've also had clients who've lived locally and have been able to come in and just kind of get what they need here at the center as well. So
awesome.
We like to aim for 30, but in theory we could have 31 or 32.
So as far as like therapy or counseling, what does that look like?
Typically when clients come in, they're assessed for the first week, and then they do the clinical intake, and then we meet with them every week for individual counseling and or therapy. We also have case managers that also work with our clients every week if they need that. I currently have a client on my caseload who is presenting with some suicidal ideation, so I'm meeting with him 3 times this week.
Awesome.
It just depends where the clients are at.
Gotcha.
We're very much a team. Again, we all show up in different ways.
That's awesome.
Yeah.
So there's definitely kind of that as needed component. Awesome.
But minimum requirement once a week for individuals.
At least.
At least.
Yeah.
At least.
That's awesome. Thank you for that. So tell me a little bit about the sober living you guys have as well. How does that work with the IOP, and just kind of what does that look like?
So Joe mentioned that we have 30 beds. The way that that's structured is each house has 10 beds. The phase 1 house programs with the phase 1 house, phase 2 with the phase 2 house, and so on.
Gotcha.
We generally suggest that each guy, when they get here, move directly into phase 1, where they have 24/7 structure, staffing, and that's where it's like the most intensive level of programming, where they are here 9 to 3 Monday through Friday. It's mandatory to meet with the doctor every single week. Phase 1 guys, we pretty much make sure they have everything that they need so that they're not calling their families and saying, I don't have any food, I don't know how to get to the center, I don't get to move around, whatever it is. We stock the house full of groceries. We bring them to the gym minimum 3 days a week. We bring them to outside 12-step meetings 7 days a week. We bring them to a Saturday outing every Saturday, and it's all pretty much handled, covered, paid for. The logistics are worked out. That's phase 1.
You hinted towards like the family program here. What does that look like, and kind of how does that work?
Yeah, no, so I would say at least half of our clients are from out of state.
Gotcha.
So we provide family sessions virtually, right, online, and then we are providing a monthly family workshop for families who want to participate in that, and that would be on a weekend here at the center. When our counselors first get their clients, they're communicating with the families, they're educating the families about what to expect around the structure here. Some of the families don't want to be as involved, right? So it's more about, do they have their own support system? And then other families want to be overly involved, so it's about codependency and enmeshment and
Right, kind of
just
finding the
providing
balance.
education and support.
How is relapse handled in this day treatment type of setting?
Sure, yeah. Really, there's a bunch of different cases that we have to take into consideration, right? Because like if, say, we had a client who goes in goes into town, takes a swig out of a bottle, calls us right away, says, hey, I'm drunk right now. I feel remorseful. Like, what can we do about that? That's going to be treated a lot differently than if we find out somebody goes and fills a Percocet prescription and then brings it into the house and shares it with everybody else, right? Like, you have to take a bunch of different variables into consideration when that's going on. That being said, as far as like a standard procedure, like we have to obviously make sure that like the client in question is either referred out to a higher level of care if something comes up, and we always provide at least 3 referrals if that comes up. We are happy to reconsider bringing them in if it's just something that like, oh, hey, again, like this was a mistake, we got to stabilize you, and then we can bring you back and have basically a therapeutic group regarding what happened, not only for the individual at stake, but also the entire community.
Right.
Or, what worse comes to worse, we're just filing everything that we need to on our end to make sure that person says, see you later. Like this is what I want to go do. It kind of can go one of a handful of different ways. But we always are offering referrals. The operations team that we have here is not only local, some of them are alumni, and they know how to handle some of those sticky situations, if you will. So we have an entire game plan in place. And thankfully, it seems like most guys show up, and if that does happen, not only are they honest about it, but we have people who are able to come back in and have been able to find success after they, realize that they're the ones who are suffering as a result of them getting loaded. It's not so much that it affects the staff team or other people. You know what I mean? Yeah.
That's what's cool about aftercare as opposed to maybe standalone sober living. Standalone sober living saved my life. I always advocate for strictly just sober living if it's what's on offer. This three strike system is great, but in aftercare, a relapse is kind of seen as a clinical issue, and there is a clinical intervention, and there's team decisions that are made. And it's like, is this somebody that should come back or not? Has this happened 4 times? Are they putting other people at risk, or did they call us immediately when something happened and took accountability for it, and we're willing and ready to change that behavior and come right back? So it's a clinical decision.
Yeah, and we definitely meet the clients where they're at, and that's part of like our extended care program. And we're very much a team, so everyone on the team has value and input. It's not just my decision or Joe's decision or Quinn's decision.
Yeah. Where did the idea or the vision for like all male treatment come from?
If we're all going to come together and build something with the goal of men learning how to live, getting back on their feet, staying sober, learning new tools, having a second chance at a first-class life, like that's going to need to be, it's going to need to be based on a philosophy and a foundation of what I've seen be the most effective, which is gender-specific, long-term, highly structured, accountability-based, not always treatment, but we're fortunate enough that we also happen to offer the treatment side of things, but we don't need to get into what issues. I'm not hating on co-ed treatment. Some of them, they do a good job, a lot of them, but it was just our sort of personal philosophy around it, based on our own personal experience and what I've seen be the most effective.
But what would you say your favorite component of this program is?
Community, no question.
Community, I like it.
We get guys that are like, I do a lot of the admissions. I get guys that are very uncertain about coming in. Families are very unsure. They've been to treatment a bunch of times. They've been in and out. And within a week or so, not every time, but most of the time, they're calling mom saying, I'm so glad I came here. I never want to leave. Never felt so connected to a community, not just the treatment community internally, but the greater recovery community. It's a beautiful thing to watch,
That's awesome, man.
First thing that came up, of course, for me was the team, because I love our team. But ultimately, I've worked in treatment for a long time, and the way that Golden Gate is structured around, like, how do the clients maintain their gains? Like, a lot of times clients go into residential and then they go home or they go to SLE. We are structured to continuously progress to a lower level of care, and so I love our structure.
Yeah, that's awesome.
Yeah.
That's awesome.
Yeah.
What about you, my friend?
Well, for me, I'd always worked in residential programs, so the longest we have people was like 30 days, and I had done marketing before that. So to actually be at a long-term program where some of these guys, we've known them for like 9 months, and we're celebrating at local meetings with them when they pick up chips, So that's really wonderful. Going to events with them outside and playing dodgeball with clients. You know what I mean? Like it's cool. So I didn't realize I was missing it until I was experiencing it again. You know, I think that aspect of what we do here is really magical.
Why do you really or truly do this work when maybe you don't have to? Why do you choose to do this work every day?
You guys looking at me?
Do you want?
No.
You can go.
Yeah. If I were to like genuinely ask myself what do I want to be doing, I truly can't picture myself doing anything other than helping guys that I identify with on a very real level. The first time I had somebody ask me my advice or my suggestion around something that had something to do with staying sober, and I was like maybe 4 months sober, someone asked my advice on something, like something clicked for me in my heart or my soul, whatever you want to call it. I'm like, I have something to offer? What are you asking me for? I can't hold a job, a relationship, my family, I'm not allowed home for the holiday. Like, what are you asking, And since I had that spiritual shift, whatever you want to call it, I just can't imagine myself doing it. It feels like a calling or a purpose.
I'm like laughing because we might have to cut part of this out. I mentioned I really love people, right? Like I've always been really curious and have had some fear around people, actually.
Yeah.
So there's this piece of it where being able to like show up and help fill a purpose where men are trying out life in recovery, and being able to like build this place and co-found this place and establish a container where that's possible has been every bit as challenging and as rewarding as it possibly could have been in the last year and change that we've been open, So for me, besides the fact that I really enjoy looking at systems and trying to make them better, which is, part of building a program, I also really am passionate about people. And the most rewarding part of what we do, or what I've seen, is obviously is watching people thrive in that environment.
Angela, what about you? Why do you do this work?
Because I would say when I was 16 and I was in a lot of pain and darkness and I didn't love myself, people came into my life and loved me. And so I swore I was going to pay it forward. I was going to give back because of the people who came into my life when I was 16 and helped me.
I love
That's
that.
why.
Well, I just kind of wanted to end with some gratitude and thank you guys for the work that you guys do. Obviously, we talked extensively about that, and I'm honored to be here, and I appreciate you guys' time, and hopefully, this video can reach a potential client that wants to know more about Golden Gate. So
Appreciate you guys having me. If anybody's watching this and needs any help or wants to learn more or is struggling and wants to reach out, you guys will put my personal cell phone on the link below, or whatever YouTube people say,
Yeah.
Hit subscribe, hit that like button, make friends in the comments, and call my personal cell.
Thank you, Dallas.
Thank you.